So when I started my PhD, I noticed that there was a mountain of information on how burnout affects physicians, but almost nothing for the people who share their lives. So that's why I focused my dissertation on the spouse perspective. I wanted to understand not just what burnout looks like for the physician, but what it feels like to live with someone who's burning out from the perspective of those people who are really deep in the trenches with them. And, everybody studies the fire, but I wanted to study the smoke. And, that's really where the human story lives in this scenario.
Welcome to the Transforming Healthcare Coaching Podcast, where we're all about helping healthcare professionals like you create positive change at work, at home, and everywhere in between. So we are super excited to have Lisa on, Dr. Muehlenbein. She is of the MedLife Matrix, and we're going to talk a bit today about why relationships are the real foundation for healthcare. And Lisa, let's get started. I'm wondering what moment or pattern first convinced you that relationships are foundational to the physician well-being? That's the actual problem is the relationships.
Right. So I've been with my husband, Steve, who's a radiologist, for 28 years, but I've literally been married to medicine for 26 of those years. So I've lived the long hours, the emotional exhaustion, the missed birthdays, and the milestones. And I've had an opportunity to see how burnout can quietly erode the connection at home. So when I started my PhD, I noticed that there was a mountain of information on how burnout affects physicians, but almost nothing for the people who share their lives. So that's why I focused my dissertation on the spouse perspective. I wanted to understand not just what burnout looks like for the physician, but what it feels like to live with someone who's burning out from the perspective of those people who are really deep in the trenches with them. And, everybody studies the fire, but I wanted to study the smoke. And, that's really where the human story lives in this scenario.
And it's so often invisible. As a program director and a director of the well-being curriculum for my own trainees, I know that theoretically we need to surround with community, have friends, have social connections. I try to get the partners involved or the spouses involved. And yet sometimes it's hard, right? A lot of times you're transplanted, you have little babies at home, and it's hard to make new friends. And so I'm curious, from your vantage point as a longtime medical spouse, what were some of those inflection points or those challenging moments, like now that when you look back as a PhD, where you're like, those were the places where we might be able to have something different moving forward?
So I really wanted to focus on the spouses of physicians because these are the people who, until now, they were invisible in this burnout research. So using Bolger's crossover theory as my framework, I explored how these stressors transferred between the partners, between the physician and their spouse, and how the relationships that they have can either amplify or buffer that strain. So during the process, I did semi-structured interviews with female spouses of male physicians across various specialties and at different stages in their career, but they were all attendings for the last 5 years. So I get asked all the time, why this specific demographic? And there's actually several reasons. So the first reason that I went with female spouses of male physicians was because during the study that I did, which was in 2024, we have had an increase of females in residencies and medical schools. But when we look at attending physicians, the male physician with a female spouse was still the greatest population for generalizability. And so I wanted to interview these spouses of these physicians who had been practicing at least 5 years at that time to encompass the pre, during, and semi-post COVID years, and specifically attendings, because when you're an attending, the entire weight of everything is on your shoulders. Whereas when you're a resident or a medical student, you still have that safety net of your attending. And those demographics, the medical students and the residents, they have additional complex stressors of their own and a high burnout rate among them. So they really need their own study too. But then I looked at layering and multiple coding cycles when I was analyzing the data so that I could ensure rigor in this study. But really, one of the biggest things that came out of it was that burnout is contagious, but so is compassion. And understanding that dynamic was really key to showing how couples can either spiral together or they can heal together. So their connection that they had when burnout was high was really almost like a predictor of how they would kind of fare long term.
That's super fascinating. And I would say that probably, I mean, when I burned out was also the first 5 years of becoming an attending. And so you are right. That's also when you're supposed to be the most productive and you're supposed to be doing all of the things and you're supposed to say yes to all the committee work. And so I can see how to keep things homogenous and have the most numbers of potential people to interview. It would make sense for you to choose that time. And so they seem more similar compared to, like
Yeah,
you said, there's just so much more variability and the diversity and the lived experiences in training. That's something you can't control for. You can't control
right.
for the way the program gives out the rules. There are probably more homogenous rules as an attending.
Yes, exactly.
I'm curious if it's okay to dive a little bit deeper into more like the sort of negative ways things filtered in. I'm curious, what were the ways that the spouses describe burnout leaking into the marriage? Like what kinds of things related to either communication or maybe emotional availability?
Yeah. So that was really kind of one of the highlights of this whole process for me was actually being able to conduct these interviews and sit down with these women who were being really vulnerable and sharing their story with me. They were amazing. But these spouses described burnout really as a slow leak and that it kind of seeps into their communication. It affects their intimacy. And, even, some of them reported physical health symptoms. And many said that they felt like single parents, but with a married title because they were doing everything for the family. All the domestic responsibilities fell on their shoulders. And when something went wrong, it was always their fault. And, there was a lot of emotional distance, irritability, and resentment. These things became common undercurrents in what I was hearing because, burnout doesn't knock on the door. It just kind of like moves in quietly.
Yeah, it does.
Yeah, it does. And then the next thing you know, it's like it's there.
Right.
But, one of the positive things was that there was also a lot of hope in the voices of these women. And when these couples recognized what was happening, they could shift from a me versus you to the fact that they recognized that they were on the same team. And the narrative kind of shift to it's now us versus the problem. And that awareness was really a turning point for them. And really, having that awareness is the first antidote. So, once the couple names it, they can navigate it together.
So amazing because it's often what the same things we say with our individual clients, right? Like what awareness then allows you to be able to figure out what to do next. And then if you can name it, you can tame that emotion. And so it is really
Yeah.
interesting how you're saying that happens even in the dyadic relationship of being a healthcare spouse.
Yeah. Absolutely.
It's funny because I wonder whether partners in healthcare really don't get a crash course in any of this, right?
No.
So from our perspective, we get to teach and tell the physicians in training. There's all kinds of anti burnout or burnout help or well being help for your career and professional development. There are no programs that invite the spouse in to the healthcare sector or allow them to really be the first line of defense. And yet they may be the little canary that helps the miner get out. And so I'm curious, if we had to leverage this counterintuitive, the spouse is probably the most important aspect. What kinds of things do you think could be helpful for spouses?
Yeah, so I'm really glad that you asked that because the data suggests that the spouse is really the physician's greatest tool against burnout. So when we're talking about burnout mitigation strategies, The home, the family, the spouse is really the foundation. But for couples who practice connection in what I like to call micro moments, these little tiny intentional acts that say that we as a couple, our relationship matters, they fared the best. And so when I talk about micro moments that matter, I'm talking about things like sharing a cup of coffee together, taking a brief walk, and even setting boundaries around post call decompression and knowing that, okay, physician gets some time before entering into family life. They need that transition. And I was just reading Brene Brown's new book, Strong Ground, and she talks about locks in like the river systems in London and talks about how it takes so many hours for the lock to get at the right level to open and let a boat through. And she talks about how this is the same for families and for like a partner coming home from a stressful day. Hopefully, it's not going to take hours like a lock does, but that transitional time period, we need time to kind of shift those gears. And so, kind of putting some boundaries around that and knowing that this person has just come in from a stressful day, not that the spouse at home hasn't had a stressful day, but that we each kind of need time to decompress and to assimilate into that transition into the new space. And so, one of my favorite strategies for these little different connections is called what I call a 10-minute touch point. So, just 10 minutes a day of undistracted connection where there's no phone, there's no charting. So, what the AMA refers to as pajama time. When the physician is working at home after hours, no charting, no pajama time, no problem solving where we're talking about how we're going to solve our marriage's biggest problems, but just connecting. Just 10 minutes to listen to each other, to really hear what the other person is saying without trying to fix it. Because a lot of spouses said, the physician is experiencing this and I want to fix it for them. I want to help them and I can't. So there's no problem solving happening here. You're just listening. You're just connecting. And, like you mentioned earlier about name it. So remembering that we can't fix what we don't face. So you can't face what you don't name, right? And so connection is so important. And it doesn't require hours. I mean, yes, lovely vacations where you can get away with no kids and just the two of you. Those are wonderful. My husband and I, we love those. We didn't get them in the early years, but now that our kids are older, it's great. But connection doesn't require those hours. It just requires intention. So when couples can commit to that, even just a few minutes can start to shift everything. It's just a little micro shift.
That, so I obviously only teach the physician side of things. And so I think this combination could really be great. The micro moment that you have at home with intentional partnering with your partner. Also, I always tell our physicians that as you transition out, when you should do your gratitude practice, your breathing, your meditation is in the car in transition. No one's going to fault you for 10 minutes in the car by yourself. Just take a moment, journal, reflect, breathe, appreciate, and just decompress for a second. Like you're allowed to have 10 minutes to yourself. And what you're saying is you're giving permission and prescription to couples where then you also, as you transition in, you both 10 minutes get used to just being with each other again because you're now taking on a new role, a new identity, right? Like you're in a partnership.
Yep.
You're in at home, you're with your kids, whatever. Use those transition times really intentionally. So that's 20 minutes of really fully trying to get out of your own head from what you were doing and now being with what you need to be.
Right. And, for couples who have small children and other demands, you might only have 10 minutes total. And it's like you each get 5, but you still get that time and you start to look forward to it. And I think that people, when they start to look forward to something and they make it more intentional, then they'll start to notice that, these little habits start stacking. We all know habit stacking is a great thing for making progress, but they'll notice that they're able to get 10 minutes in the morning and then 10 minutes at night or 10 minutes after bath time, or maybe there's 10 minutes between cases that you can send, your loved one a text at home to let them know you're thinking about them. And just these little micro habits add up.
I love that. So I also can see, like, this is probably the reason why people love having a dog that greets them at home. Because, you sort of distract they need to be walked, they need to get some fresh air, some exercise, you have
Yep.
a tail wagging, and so if we all could be the better puppy for each other,
Yeah.
then we're able to just bring a little bit of joy and just to make that transition a little bit easier and to be there for each other because we're just being present, right? If we think about why a
Yes.
dog brings us so much joy, aside from walking outside and being in nature, it's also just being. That's enough.
Yes. Mine is laying under my desk right here.
That's amazing. That's amazing. So I guess I'm also curious if we move it to the leadership side of things. A lot of times we don't bring even the fact that we have a partner or a spouse into our work negotiations, our work conversations. So for leaders, if relationships are so foundational to the health of your team, of your individuals, the people that work for you, what's the most practical change that you think for chiefs and bosses, chief wellness officers to be able to normalize a very spouse inclusive education or be able to provide more supports? For people who are married?
So the first thing is awareness that there's a problem. 80% of the factors that contribute to physician burnout are attributed to organizational issues. So we need to keep that in mind. But if medicine truly wants to address the issue of physician and practitioner burnout, it has to treat the physician family. It has to treat that family unit as one system. And what that means is spouse inclusive education, partner coaching, and a schedule that's designed to actually allow for recovery and connection. So we know physicians work on average more than the general population, 60 hours a week plus. And I know my husband he works a 9-hour day, but he also gets up and he works before, he works after if I have something going on. It's just who he is. And I think sometimes these physicians, they have trouble kind of turning off their brain. But, I talked earlier about like the not me versus you, but us versus the problem and thinking of it as we're all on the same team. So if we think of medicine as a team sport, the home is part of that team. So when organizations recognize that, everybody wins. Burnout decreases, retention improves, family satisfaction rises. And when burnout decreases, there's less medical errors and more patient satisfaction and less lawsuits. So it's like winning all over. So I think it's important for organizations to be aware that healthy families don't just support healthy physicians, but they help to sustain healthy organizations.
That's like, I need to take that and just make a quote out of that because I do think I agree that leaders, and this is why we're transforming, we really are see ourselves as a leadership plus well-being coaching company because if we don't think about well-being first, and so for you with MedLife Matrix, it's really about making the family unit well and healthy. That's so foundational to be able to have clinicians to be able to perform and do their job and be healthy and happy and whole when they show up at work. What we're saying is leaders need to be measured by how well they support the family unit, which means actually having conversations and not being afraid
Yeah.
about asking the really scary questions are how are things at home? Things
Right.
aren't always very pretty at home, actually.
No.
And people are really afraid to talk about it. And it's really hard to find a good friend to be able to talk about these things and we don't even know where the resources are. And then
Right.
oftentimes you get pushed off to EAP only when you need therapy or counseling. But there's so many things that can be done proactively as a cultural standard in our teams and our groups with team building is to get to know our families, right? Do you even know your colleagues' number of children, major life events that are happening? All those types of things do impact, desire to work, ability to work, and honestly, also how much you really can step up and do more projects, right? Because if you're going through a huge transition and you're about to launch your kid and graduate right from high school, It's a busy time of the year. You're not going to be able to do another huge heavy lift in the group. And so as the group knows, then they can all help each other grow
Yeah.
together.
Yes. Yes. And so when you think about the team dynamic, if my husband loves sports, right? And so when you think about like a football team, right? We're right in the midst of football season. So you've got the offense, you've got the defense. Each of those has a coach, right? And then there's the head coach. But they're not working against each other. They are working together to make sure that that team functions like a well-oiled machine. And so when we talk about leaders in the C-suite and in organizations, we need to look at them, or they need to look at themselves as the head coach. And they need to make sure that all members of their team are getting what they need to function properly for the same goal.
I think this is where, if we don't invest in people first, we don't invest in families first, it's no wonder then we often are left with problems later. And so someone was asking me, like, what do I think and predict what really needs to happen? I think this whole paradigm shift of people first and the quality of what we're experiencing, because then we can stop this cycle, right? Of what we're talking about, what you and I are talking about, that the 80% is the organizations, that a lot of this is we've falsely constructed and told ourselves we shouldn't talk about these things. When why don't we have a conversation? Why don't we have team building and have leaders that want to make our teams more well? Because I mean, nobody enjoys recruiting and firing and hiring and all of that. No one likes staff turnover. When you have a really stable group, that's what actually everyone wants.
Yes. That is more attractive to an incoming or potential hire, like to know that they're coming into a culture that supports wellness or well-being and is going to support them hands down. Yeah.
Right. And it's funny because it's an easy recruitment, right? Like they can see it, you can feel it. All it takes is
Yeah.
one meeting and then and then it's done. And so it's no
Yeah.
wonder that those who are doing really well continue to do really well. And those of us who are just putting the financial metrics ahead and like doing the contractual and the industry standard, it's just causing more of the same, and which is causing more of the leaks in the system as well. I do want to sort of transition a little bit about like along these lines. Like if we had to paint a picture then for health systems, if they designed that the family physician a unit was more core, the leaders were trained in all of these things, that we have more resources, we have more coaching, what do you think the culture could look like? 'Cause I also feel like sometimes people can't go there until they can see it and dream it. And so I'm wondering, are there research gaps that you're thinking about? Are there places that you think that can be easy fixes right now that we could do?
Yeah. So my vision would be that health systems start seeing families as stakeholders in physician wellness. So imagine orientation programs that include spouses, leadership training that teaches relational awareness, and benefits that truly support the family ecosystem. For example, there is a local business here that is in the biotech industry, and they are one of the largest corporations in the world, but their headquarters is here where I live in Naples, Florida. And they have childcare for their staff. I know some hospitals do have that, but really thinking about how can we support our physicians better, because they're the ones that are supporting the organization and they're the ones that are treating our patients. And so really that's what the MedLife Matrix is all about. When we look at the physician, their spouse, the organization, the patient, it's about helping physicians, their spouses, and these organizations rebuild the connection, helping them restore balance so that they can thrive together. Again, that team mentality of we're working together towards a common goal. And thriving together really isn't just a slogan, but really can be a systems strategy. So when we strengthen the family, we strengthen the family of medicine.
Such a beautiful vision. So, which actually leads us into something that we want to talk about today together, which is about our medThriving virtual summit. Lisa, you're one of our guest speakers at the medThriving Summit, which we will put a link in the show notes below for how you can buy a ticket. If you want to be part of the change maker society in healthcare and begin to think about leading your own life, leading how your relationships can be better, how you can strengthen your foundations so that you can show up better as a healthcare professional. That's what our medThriving virtual conference is about. And so, would you like to give our audience a little bit of a taste or a pearl or a tidbit about what you're going to be speaking about at the conference?
Sure, sure. So I'm really happy to be part of this conference and really supporting the work that medThriving is trying to do because it's so intricate in supporting our physicians and their families. And so for me, I'm happy to be there talking about how we can support physicians and their families together to strengthen this healthcare system because it really is what we're all here for. But different tactics that we can employ to really address that need, address how do we address burnout? How do we support the family? What are additional ways that we can support the physicians? What are practical skills and applicable techniques that we can use to really make this matrix work? Not just part of it, because if it all isn't working, then we're on a three-legged stool.
And so we're really excited. So if you're listening to this episode and you're like, oh, my friend is married to a doctor, or I have a colleague that she's in my mom group and she's with a PA or she was with a doctor or a nurse, you can check out our virtual summit because we include everyone who is adjacent and touching because it is with everyone together, but with the organization, the patients, society, the physician, the clinicians themselves, and also the partners, the spouses, those who support all of us in this family. So we'll put all the link and information for below. When this episode airs, this will be in December 2025. And so it's a great gift to give someone that you know, and we're super excited to have Dr. Muehlenbein here with us. So, my last question for you, sort of a fun and quirky one. Just what kinds of books or things are you listening to? What podcasts, what books? You already mentioned one by Dr. Brene
By
Brown, but
Brene Brown, yes, it's
there you
right
go. I
here.
haven't gotten it yet. So that's
Yes.
exciting.
Yeah, she's amazing. I've read every one of her books, and every single time I find such amazing pearls of wisdom that I just love her so much because she does so much great work for organizations as well. So that's really, really important. And I gotta say, I know I turned 50 this year. And so I've actually become a Swiftie at 50. And I'm very much listening to some Taylor Swift Life of a Showgirl on my playlist. And it's really interesting to hear some of the things that I'm like, oh wow, that's like medical life. There's a lot of crossovers. So, the show never ends. You're always keeps going and finding those little moments away and getting to like what is on your wish list and what's really important and some of the things that you would give up just really to have quality time with your partner and have that connection. So there's a lot of parallels there. So those that's my book and that's my playlist for the moment.
Awesome. Thank you so much for coming on our Transforming Healthcare Coaching podcast. And we're looking forward to seeing you at the virtual summit in December. So, everyone, feel free to please share this episode with your friends and colleagues. Subscribe to us. It means a lot to us. And feel free, if you have things you want us to address for 2026, email us at podcast@transforminghealthcarecoaching.com. And we'll see you next time. Thanks so much for listening. If you found value in today's episode, please subscribe and share with a colleague who would benefit. Together, we can transform healthcare one person at a time. Find us anywhere you find your podcasts. Ready to take your healthcare leadership journey to the next level? Book a discovery call, free, at transforminghealthcarecoaching.com to explore our personalized coaching packages designed specifically for healthcare professionals like you.